YouTube channel, and in succession to the videos what I have been taking up in general medicine and general surgery. So today's video I'll be mainly discussing upon a very important short note question. In medicine and surgery, both ways it can be asked about the malignant hypertension. So students and viewers, beginning with, so in this video we'll be discussing about what is this malignant hypertension and what is its etiology. Apart from this, what are the clinical features and what is the diagnosis and treatment. So beginning with malignant hypertension. So actually you might be very well aware that hypertension, it is a condition where the blood pressure is elevated. And actually nowadays, the in the youth, in young adults also, it has been found that the normal blood pressure is approximately 140 by 90. This up till this range it can be considered normal. But what do we find is that in in situations like malignant hypertension, so in such a situation what is going to happen is that the blood pressure is getting accelerated, and both the systolic as well as the diastolic blood pressures, they are going to be elevated. So the normal blood pressure range, what you must have earlier studied, is naturally it is 120 by 80 mm of Hg. But there are certain conditions what is called as pre-hypertension. So in conditions of pre-hypertension, if the blood pressure is rising from between 120 to 140 and upon 90, so such a situation, it is called as pre-hypertension. But today's topic will be mainly focusing upon the term that is malignant hypertension. In other words, it is also called as accelerated hypertension. So malignant hypertension, it is a complication of hypertension characterized by very elevated blood pressure and organ damage in eyes, brain, lungs, and kidney. So in conditions of malignant hypertension, it has been seen that not only the blood is flowing in a great pressure in the blood vessels, it is going to have deleterious and adverse effects on the target organs. It on the multi-target organ, it has got its effects. So actually when it is going to affect the eyes, brain, lungs, and kidney, so such a situation is very dangerous. And it is mostly seen that once the systolic pressure is above 240 millimeters and the diastolic pressure is above 140 mm of Hg, so such a situation, it is called as malignant hypertension. And the most important, striking, distinguishing, differentiating factor for malignant hypertension, it is that it is mostly accompanied by papal edema. So what is papal edema? So papal edema, it is a condition, it is a situation what is very frequently seen only in the condition of malignant hypertension. And in situations of malignant hypertension, what do we find is this papal edema, it is a very common manifestation. Now in papal edema, what is going to happen is that there is going to occur edema and inflammation of the optic nerve. So you must have seen, if the blood pressure is going to rise so much, that is the systolic is rising above 240 and the diastolic is rising above 140 millimeters of Hg, and ultimately it is going to have such an adverse effect that it can ultimately affect the eyesight as well, and there can be rupture of blood vessels which are supplying to the eyes. So actually the papal edema is going to manifest in malignant hypertension, and there is edema and inflammation of the optic nerve. So optic nerve, what is supplying to the eye, so there is edema and inflammation of the optic nerve at the point of entry in the retina. So in such a situation of malignant hypertension, this papal edema, it is the most important point, differentiating point, because this malignant hypertension is going to have multi-organ damage. It leads to very many deleterious effects on very many organs of the body, such as the kidneys are affected, the lungs are affected, the brain is affected, so the heart is affected. So if the BP is not controlled in such a situation, the patient is not reporting to the hospital, that is not going to the doctor, so such a effect can have a very vast uh, adverse effects on the body, such as it can even lead to heart attack, it can even lead to stroke, it can even lead to acute kidney injury. So such conditions can happen. Now looking at the etiology of malignant hypertension, so once we look at the etiology of malignant hypertension, there are certain chemicals such as cocaine. So those patients who are, those people who are abusers such as cocaine, so in cocaine, what do these chemicals, apart from this, there are certain medications such as beta blockers, the amphetamines, the monoamine oxidase inhibitors. These are the certain medications what can predispose to malignant hypertension. Apart from this, this malignant hypertension is can be seen in the overweight patients or the obese patients, the patients who are in the habit of consuming alcohol and smoking. Apart from this, stress in situations of atherosclerosis, in conditions of chronic diabetes mellitus. So the malignant hypertension can be seen in patients who have a long history of diabetes. Apart from this, in cases of kidney disorders such as the renal arterial stenosis, if it is there, so in such a situation this malignant hypertension can be seen. Now moving on to the clinical features. So once we look at the clinical features, what do we find is that chest pain is present. So such patients, since the blood pressure is so much elevated, so it can manifest in the form of a chest pain. The patient can have shortness of breath, that is dyspnea can happen. Apart from this, there can occur neurological effects as well. So the neurological defects, such as the condition is unable to change in the mental status, the neurological manifestations can be there, that the person can have change in the mental status. Apart from this, the patient can have the cardiac symptoms, such as the just because of uncontrolled such a high blood pressure is there, the patient can even manifest with the symptoms of angina, that is chest pain, and even the patient can assume can have a heart attack, that is myocardial infarction. There can be pulmonary edema, because if the kidney failure is there, if such a situation arises, there can be the condition of pulmonary edema can also arise, where in the extra uh, vascular compartment there can be accumulation of fluid. The patient can exhibit in malignant hypertension the headache, particularly if the blood pressure is not controlled to a severe extent, so it can lead to cerebral hemorrhage, as well as certain infarction can occur, and that can predispose to later on in a stroke. So actually the visual disturbance is there, that is the blurring of vision can be seen as one of the clinical features, that is hypertensive encephalopathy is seen. So just because the BP of the patient has risen so much, so hypertensive encephalopathy, it is a very important condition in cases of malignant hypertension. And in this, what do we find is that the patient may manifest with headache, vomiting, seizures, and the change in the mental status of the patient can be seen. Apart from this, there can occur the gastrointestinal symptoms such as nausea and vomiting. Apart from this, the patient may pass, since if the BP is uncontrolled, so ultimately the since the kidneys are purifying the blood, so actually once the blood rushes into the glomeruli of the kidney, so there can be acute kidney injury, and just because of acute kidney injury is there, the patient may manifest with oliguria, and there is natriuresis. So there can be loss of electrolytes such as sodium, and sodium electrolyte can be lost through urine, so there is natriuresis. Apart from this, one half of the patients who are suffering from malignant hypertension, they do exhibit the symptoms of hypokalemia, and they have pressure diuresis. Apart from this, they may also show in the blood hypokalemia, since excess of potassium is being excreted through urine, so the patients may exhibit the symptoms of hypokalemia. And apart from this, the hyponatremia is also occurring, just because natriuresis is taking place, excess of sodium, the sodium is being constantly flushed out through urine, through natriuresis. So what is going to happen is the patient may exhibit the symptoms of electrolyte balance, that is hyponatremia and hypokalemia. Now, what are the investigations what the doctor is mostly suggesting the patients with malignant hypertension? So the diagnosis, when we look at the diagnosis, the doctors may call upon that they can ask the patient for a complete blood cell count, as well as the coagulation profile, that is the bleeding time, the clotting time. All these things needs to be assessed. The doctor may advise the patients to have this kind of the coagulation profile, as well as the electrolyte profile is very important in cases of malignant hypertension. What do we find is that electrolyte profile of the patient is to be assessed, that is the evaluation of the sodium and potassium in the blood serum. It needs to be evaluated. Apart from this, to check about this since oligouria is there, so the urine analysis will be done, just because the condition of natriuresis is seen in malignant hypertension. Apart from this, the doctors may advise for any kind of a thyroid checkup, just because if any disorders in the thyroid can happen. Renal function test, because malignant hypertension is going to cause a multi-organ damage. Since multi-organ damage is there, can be there, so doctor may suspect that what either in any of the following organs of heart, kidney, liver, coagulation profile, blood. So any kind of a changes, just to monitor in the various organs of the body, such as for kidney, he can ask you about the renal function test. He can even ask for the chest radiograph. Apart from this, for any kind of a stroke or head, any kind of an infarct what is reaching the head in the brain, so the doctor can even advise for the head CT scan. Apart from this, to monitor the heart, because the high blood pressure is going to have an effect on the heart muscles as well, so that the doctors may advise to go for an electrocardiogram to see for any kind of an ischemia or an infarction. So this was all about the diagnosis, what the doctor is going to advise. Apart from this, when we look at the treatment, so the most commonly used method of treatment in malignant hypertension, it is through intravenous drug route, and intravenously through IV method, the first resort to treatment is through the administration of phenol through the intravenous route. Apart from this, the labetalol can be given. Labetalol is given to the patient, and particularly in women who are suffering from preeclampsia, that is the gestational hypertension, that is after 20 weeks of gestation, if the pregnant woman is having this kind of a hypertension, so in such women hydralazine is reserved for pregnant women. So viewers and students, this was a very short discussion about malignant hypertension, and this you can be very frequently asked in the professional exams in the form of a short note, so where you are supposed to write about the definition, the etiology, the clinical features, the diagnosis and the treatment of malignant hypertension. Students and viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.